Assalamu alaikum warahmatullah. Our talk today about teratogenesis. What is the meaning of teratogene? A teratogene is any agent that physically or chemically alters the developmental processes and produces congenital deformities. Should produce congenital deformities, which can be any chemical like drug or physical condition, radiation, or deficiency, can alter the fetal function or morphology. Anything that can change the fetal function or morphology called a teratogene. Okay, what are the causes of congenital anomalies? The causes, unknown causes, consist of 70% of cases, genetic 20%, environmental factors include 10% of cases. Intrauterine infection 2%, maternal metabolic diseases if the mother affected by any metabolic disease, this 20% of all anomalies, drug and chemicals 5%, radiation 1%. Factors determining the effect of teratogene. There is factors determine that teratogene can affect this fetus. There is fetal factor and there is maternal factor. Fetal factors include developmental stage. According to the stage of the gestation, the baby or the fetus can be affected. There is pre-differentiation stage, which is from 0 to 7 days, and if the teratogene affects the fetus in this period, this will lead to either death or effect. Differentiation stage, which is from 7 to 57 days of gestation, this can lead to malformation, or post-differentiation stage after 57 days of gestation, which can lead to functional defect or growth retardation. There is also genetic susceptibility, and these constitute of individual differences between fetus to fetus according to the route and length of administration of teratogene. Effect of teratogene, the immediate effect, adverse effect, and delayed effect. Immediate effect can lead to death and abortion, or adverse effect, and this can lead to malformation, functional effect, or delayed effect, which can lead to carcinogenesis and mutagenesis. The maternal medical disorder that can affect the fetus, for example, diabetes mellitus, in which an infant of insulin-dependent diabetic mother, if the mother is treated by insulin, have up to 22% incidence of cardiac, renal, gastrointestinal, or central nervous system and musculoskeletal malformation. Most of these can occur between 6 and 8 weeks of gestation, okay? If the mother affected by epilepsy, also these can affect the fetus. Phenylketonuria, infants has increased incidence of mental retardation or microcephaly, which means a small head of the baby, or can lead to low birth weight. If the mother also affected by virilizing tumor, which tumor produce testosterone or male hormones, it can lead to what is called pseudo-hermaphroditic changes in female uterus, which male changes in female uterus. Second, infections. If the mother affected by any infections, this also can become a teratogene that affect that fetus, like syphilis. An uterine infection can lead to preterm labor or stillbirth or miscarriage. If the fetus affected, it can lead to congenital infection, can lead to hepatosplenomegaly, joint swelling, jaundice, anemia, and skin rash. Also, toxoplasmosis can affect the fetus. Rubella virus, if the mother affected by rubella virus. The congenital rubella syndrome can lead to central nervous system, cardiovascular, ocular, and ear defect, and even can lead to intrauterine growth retardation. Also, cytomegalovirus, herpes simplex virus 2. In herpes simplex, infection during first trimester, this can lead to abortion. Also, ionizing radiation, this can affect the fetus according to the dose of exposure, if for long time, if for repeated time, and so on. Risk of leukemia, or also if the mother exposed to X-ray. Also, thyroid of the baby or the fetus can be affected if the mother exposed to radioactive iodine. CNS abnormalities, mental retardation, can occur according to the dose of the radiation. That's mean non-urgent radiograph can delayed after 17 week of gestation, which decrease that teratogene effect on the fetus. Chemicals effect of late. It can lead to embryotoxicity or intrauterine growth retardation. Organic mercury also can lead to neurological damage, blindness, and deafness. Also, drugs. If the mother uh, take specific drugs during pregnancy, this can affect the fetus and become a teratogene. There is category A like rifampicin, gentamicin, aminophylline, and beta blocker. These drugs can be administered only if their benefit outweigh the potential fetal harm. That's mean these drugs not be used until the benefit for the mother is more important than fetal harm. Okay? Category B, there is phenytoin, valproic acid, diazepam, spironolactone. These drugs are given only in serious disease and no alternative. In this situation, we can give the mother these drugs because also it is a teratogene. Okay? Also, effect of alcohol consumption. Increase the rate of abortion and stillbirth. Fetal alcohol syndrome, in which the baby can lead to mental retardation, intrauterine growth retardation, abnormal faces, ocular cardiac joint anomalies. All these can affect the fetus who the fetus his mother take alcohol. Also, cigarette smoking. If the mother is a smoker, this can lead to late abortion, preterm rupture of membrane, can lead to accidental hemorrhage, preterm labor, and even can lead to neural tube defect. Also, the vaccination of the mother, active immunization, in which the vaccine is live attenuated, should be avoided. Like a rubella vaccine, this should be avoided during pregnancy. But there is also killed vaccine like cholera, typhoid. This given only when traveling to endemic area. In the toxoid vaccination, there is no contraindication can be given to the mother. Okay, and that is all. Good luck and thank you so much.